Hello everyone, I am Annie Rabago, your student nurse for today, and I will be doing the return demonstration of intradermal injection. Intradermal injection is the administration of a drug into the dermal layer of the skin just beneath the epidermis. This method of administration is frequently used for allergy testing and TB screening. The common sites for IV injections are the inner lower arm, upper chest, and the back beneath the scapula. Left arm is commonly used for the TB screening. Right arm is used for all other testing. The purpose is to provide a medication that the client requires for allergy testing and TB screening. Okay, let's start. So before anything else, of course, we need to check the doctor's order. Let's pretend that this is our doctor's order. Let's check to avoid error and to make sure that what you are about to administer is to the right person or individual. And next, check the medication administration record, the MAR. Let's pretend that this is the MAR, and let's check to verify and to avoid error again. Next is to check the label of the medications carefully against EMAR to make sure that the correct medication is being prepared. Again, to verify the order of the doctors and confirm the order and to avoid error. So let's organize equipment. Here's the medication. Of course, in dealing the medication, we need to check the expiration date, the lot number, and the manufacturer date. So it's been checked. We already counted, so we have the injection, this is the needle that we needed extra, alcohol swab, and the clean gloves, and everything is ready. The organization of the equipment will facilitate accurate scale performance. So after washing our hands, let's prepare the medication vial for drug withdrawal. Mix the solution if necessary by rotating the vial in between the palms of your hands and not by shaking. Why? Because some vials contains aqueous suspensions which settle down when it's stand, and in some instances shaking is contraindicated because it may cause the medication or the mixture to foam. So let's go ahead. Let's remove the cup and let's clean the rubber cap out of the circular motion from inner to outer rotation. So we already know this part. We already know that always cleaning the things to avoid or to deter the spread of microorganisms or reduce the microorganisms. So after that, withdraw the medication. So let's attach the filter needle. Since we don't have the filter needle, let's just use the needle here. And again, that's agency practice dictates to withdraw up pre-mixed liquid medications from multiple vials. The rationale for that is using the filter needle prevents any solid particles from being drawn up through the needle. So ensure the needle is firmly attached to the syringe also. Maintain the sterility and Get the cup out from the needle, then we draw up into the syringe the amount of air equal to the volume of the medication that we will withdraw.
Carefully insert the needle into the upright vial through the center of the rubber cap, maintaining the sterility of the needle. Inject the air into the vial, keeping the bevel of the needle above the surface of the medication. The reason for this is the air will allow the medication to be withdrawn out easily because negative pressure will not be created inside the vial. The bevel is kept above the medication to avoid creating bubbles in the medication. Withdraw the prescribed amount of the medication using either of the following methods. Hold the vial down, move the needle tip so that it is below the fluid level, and withdraw the medication. Avoid drawing up the last drops of the vial. Proponents of this method say that keeping the vial into the upright position while withdrawing the medication allows particulate matter to precipitate out of the solution. Leaving the last few drops reduces the chance of withdrawing foreign articles. Or invert the vial, ensure the needle tip is below the fluid level, and gradually withdraw the medication. The rationale for this is keeping the tip of the needle below the fluid level prevents air from being drawn into the syringe.
Next, I'll be explaining the procedure, and I'll be introducing myself and also asking her identity to verify that she's the right client to administer the medication. Giving information to the client will facilitate acceptance to and compliance to the therapy. So here we go. Hi ma'am, good morning. I am Annie Ravago, your student nurse for today. May I know your name, please?
Dominic.
Hi ma'am, Dominic. Today I will be doing the skin tests for you, and I will produce a small wheal. It's sometimes called a bleb. It is like a blister, so it might cause you pain, but it will just gradually be okay. I'll provide privacy for my client by closing the doors, drawing the curtains, and we'll begin. It's time to select the site. It should be 3 to 4 finger width below the antecubital space, and it should be somewhere here. And check for inflammation, any tenderness, report it if there's tenderness or pain noticed. Now I will begin. Put on my gloves. Now I'll be cleaning the site with the antiseptic swab in a circular motion from inner to outer, and allow to dry to prevent irritation.
Prepare the syringe for the injection. Remove the needle cap. While waiting for the antiseptic to dry, expel any air bubbles from the syringe. Small bubbles that adhere the plunger are of no consequence because a small amount of air will not harm the tissues. Grasp the syringe in your dominant hand, close the hub, holding it between thumb and forefinger. Hold the needle almost parallel to the skin surface with the bevel of the needle up, because the possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. Inject the fluid with the non-dominant hand. Pull the skin at the site until it taut. For example, if you're using the ventral forearm, grasp the client's dorsal forearm and gently pull it, tighten the ventral skin. Taut skin always for easier entry of the needle and less discomfort for the client. Insert the tip of the needle far enough to the place of the bevel through the epidermis into the dermis. The outline of the bevel should be visible under the skin surface. Stabilize the syringe and needle. Inject the medication carefully and slowly so that it produces a small wheal on the skin. This varies that the medication entered the dermis. Withdraw the needle quickly at the same angle at which it was entered. Activate the needle safety device. Apply a bandage if indicated. Do not massage the area because massage can disappear the medication into the tissue out through the needle insertion site. Close the syringe and needle in the sharps container. Do not recap the needle in order to prevent needle stick injuries. Remove and discard gloves. Perform hand hygiene. circle the injection site with ink to observe the redness or induration hardening per agency policy. Document all relevant information. Record the testing material given the time, dosage, route, site, and nursing assessments.
Hello, I am Annie Ravago, your student nurse for today, and I will be doing the return demonstration of parenteral drug administration. I will be doing the general preparation. First, we need to check the doctor's order to verify the doctor's order. Next is to check the medical administration record to avoid error and verify that everything is right. Check the label on the medication against EMAR. Since we don't have EMAR, I'm going to check the medication ticket to make sure and verify that what we are preparing is the right drug to administer to the right patient. Now follows the 3 checks on administering the medication. Read the label on the medication. So first, when is it taken from the medication card? Second, before withdrawing the medication, and the third, after withdrawing the medication. I'll be preparing my equipment to have a better access during the administration of the drug and save time and effort. Now I'll be preparing my clean glove, alcohol swab, my syringe, and also ideally we need to have the filter needle, but I'll be using the regular one, and the medication, the ticket. Prepare the ampoule medication for drug withdrawal, and whenever possible, change the needle syringe on the syringe with the new needle, because the new needle is free from medication and it will avoid or does not hurt or irritate the subcutaneous tissues when it passes the muscle.
Flick the upper stem of the ampule several times with a fingernail. This will bring all medication down to the main portion of the ampule. Use an ampule opener or place a piece of cereal gauze or alcohol wipe between your thumb and the ampule neck or around the ampule neck, and break off the top by bending it towards you to ensure the ampule is broken away from yourself and away from others. The cereal gauze protects the finger from the broken glass, and any glass fragments will spray away from the nurse. Or you can place the antiseptic wipe packet over the top of the ampule before breaking off the top. This method ensures that all glass fragments fall into the packet and reduces the risk of cuts. Dispose the top of the ampule in the sharp containers. Withdraw the medication, places the ampule on a flat surface, attaches the filter needle straw to the syringe. The filter needle or straw prevents glass particles from being withdrawn with the medication. Removes the cap from the filter needle and insert the needle into the center of the ampule. Do not touch to the rim of the ampule with the needle tip or shaft. This will keep the needle sterile. Withdraw the amount of draw requires for the dosage. With a single dose ampule, hold the ampule slightly on its side if necessary to obtain more than the ordered amount of medication. Dispose of the filter needle by placing the sharp container. If giving an injection, replace the filter needle with a regular needle. Tighten the cup at the hub of the needle and push solution into the needle to prescribed amount.
I'll be providing my client's privacy by closing the door or drawing the curtains, and I'll be introducing myself, verifying the patient so that I'll know if he is the right individual patient to administering the drugs. Hi sir, may buntag. Ako siya Annie Ravago, ang imong student nurse for today. Imong pangalan sir?
James Day.
Salamat sir. Ang edad?
24.
Birthday?
99. April 8.
Okay sir, ako lang i-check kadali sir ha. Okay. karon ang atong pagahimoon Sir James, mag-inject ko sa imuha og tambal di sa imuha ang bukod. Karon Sir James, ako ning limpyuhan og after that itusok na ko unya pagahuman Sir James, maka-feel ka og sakit ani dinha nga site sa atong gi-injectionan. Okay? Opening the swab, cleaning it from inward to outward in circular motion. So from here, sa deltoid, the site, and this part.
Allow skin to dry prior to injection medication. This will help reduce the discomfort of the injection. Prepares the syringe for injection. Remove the needle cover and discard without contaminating the needle. If using a pre-filled unit dose medication, take caution to avoid dripping medication on the needle prior to injection. If this dose occur, wipe the medication off the needle with a sterile gauze. Some sources recommend changing the needle if possible. Medication left on the needle can cause pain when it's tracked through the subcutaneous tissue. Injects the medication using the Z-track technique. Uses the ulnar side of the non-dominant hand to pull the skin appropriately 2.5 cm to the side under some circumstances, such as for an emaciated client or an infant. The muscle may be pinched, pulling the skin's subcutaneous tissue or pinching the muscle. Makes it firmer, facilitates needle inserting, holding the syringe between the thumb and forefinger. Pierce the skin quickly and smoothly at a 90-degree angle and insert the needle into the muscle using quick motion. Lessen the client's discomfort. Holds the barrel the syringe steady with your non-dominant hand. Aspirate the pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. If the needle is in a small blood vessel, it takes time for the blood to appear. If blood appears in the syringe, withdraw the needle, discard the syringe, and prepare new injection. These steps determines whether the needle has been inserted into a blood vessel. If the blood does not appear, inject the medication steadily and slowly, approximately 10 seconds per ml. While holding the syringe steady, if using the ventral gluteal site, injecting medication slowly promotes comfort and allows time to tissue to expand and begin absorption of the medication. Holding the syringe steady minimizes discomfort. One study found that rapidly injecting vaccines without aspirating caused less pain. After injection, wait 10 seconds. If using the ventral gluteal site, waiting permits the medications to disappears into the muscle tissue, thus decreasing the client's discomfort. Withdraws the needle smoothly at the same angle of insertion. This minimizes tissue injury. Release the skin. Applies gently pressure at the site with a dry sponge. Use of an alcohol swab may cause pain or burning sensation. It is not necessary to massage the area at the site of injection. Massaging the site may cause the leakage of medication from the site and result in irritation. If blood occurs, apply pressure with dry sterile gauze until it stops. Activates the needle safety device or discard the uncapped needle and attach syringe into the proper receptacle. Removes and discard gloves and perform hand hygiene. Documents all relevant information, the time administration, drug name, dose, route, and the client's reactions. Assesses the effectiveness of the medication at the time it is expected to act.
I will be doing the general preparation. First, we need to check the doctor's order to verify the doctor's order. Next is to check the medical administration record to avoid error and verify everything is right. Check the label on the medication against EMAR. Since we don't have EMAR, I'm going to check the medication ticket to make sure and verify that what we are preparing is the right drug to administer to the right patient. Now, follows the 3 checks on administering the medication. Read the label on the medication. So first, when is it taken from the medication card? Second, before withdrawing the medication. And the third, after withdrawing the medication. I'll be preparing my equipments to have a better access during the administration of the drug and save time and effort. Now I'll be preparing my clean gloves, alcohol swab, my syringe, and also ideally we need to have the filtered needle, but I'll be using the regular one, and the medication, the ticket. Okay, by providing my patient's privacy, I need to close the door or draw the curtains to provide comfort and privacy. Then, next, I will be introducing myself and explain the procedure to gain the cooperation of my patient, and if necessary, to ask an assistance for the uncooperative patient. And I will explain the site of the medication, site of the I will be placing my patient on a supine position to have a better access of the site where I will administer the drug. And now I'll be explaining it to my patient. Hello, sir. Good morning. I am your student nurse for today. I am Annie Ravago. May I know your name, sir?
Aryan.
Hi, sir. Aryan. Today, I would love to ask, when is your birthday?
December 11 at 2012.
Alright. So, sir, today we will be doing the subcutaneous administration of the injection of your insulin. This will help to balance or lower your glucose, blood glucose level, okay?
Okay.
And I will be placing you on a supine position, exposing your abdomen, and that's where the site will be the site where I will administer your medication. Is it okay, sir?
Yes.
Alright. So I'll be placing my patient and maintaining my body mechanics all the time. Sir? Now I will be exposing your tummy, sir. Assessing for any redness, any sore, or any swelling. Report if there's if necessary. So apply clean gloves.
Oh, these gloves can save me. Hopefully the gloves save me. Oh.
Maintain body mechanics. Now,
Select a site free of tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation. Select a site that has not been used frequently. These conditions could hinder the absorption of medication and may also increase the likelihood of injury and discomfort at the injection site. Applies clean gloves as agency protocol indicates. Clean the site with an antiseptic swab. Start at the center of the site and clean in a widening circle to about 5 cm, 2 inches. Allow the area to dry thoroughly. The mechanical action of swabbing removes skin secretions, which contains microorganisms. Using the technique keeps the readily accessible when the needle is withdrawn. Prepares the syringe for injection. Removes the needle cap. While waiting for the antiseptic to dry, pulls the cap straight off to avoid contaminating the needle by the outside edge of the cap. The needle will become contaminated if it touches anything but inside the cap, which is sterile. Dispose the needle cap, injects the medication. Grasp the syringe in your dominant hand by holding it between your thumb and fingers with palm facing to the side or upward for 45 angle insertion, or with the palm downward for a 90-degree angle insertion. Prepare to inject. Using a non-dominant hand, pinch or spread the skin at the site and insert the needle using the dominant hand and a firm, steady push. Recommendations vary about whether to pinch or spread the skin and what angle to administer subcutaneous injections. The most important consideration is the depth of the subcutaneous tissue in the area to be injected. If the client H has more than half inch of adipose tissue in the injection site, it would be safe to administer injection at the 90-degree angle with the skin spread. If the client is thin or lean and lacks adipose tissue, the subcutaneous injection should be given with the skin pinch at 45 to 60-degree angle. One way to check that the pinch of the skin is subcutaneous tissue is to ask the client to flex and extend the elbow. If any muscle is being held in the pinch, you will feel it contract and relax. If so, release the pinch and try again. When the needle is inserted, move your non-dominant hand to the end at the plunger. Some nurses find it easier to move the non-dominant hand to the barrel of the syringe and the dominant hand to the end of the plunger. Injects the medication by holding the syringe steady and depressing the plunger with a slow, even pressure. Holding the syringe steady and injecting the medication at an even pressure minimizes the discomfort for the client. It is recommended that with many subcutaneous injections, especially insulin, the needle should be embedded within the skin for 5 seconds after the complete depressions of the plunger to ensure the complete delivery of the dose. Removes the needle smoothly, pulling along the line insertion while depressing the skin with your non-dominant hand. Depressing the skin places countertraction on it and minimizes the client's discomfort when the needle is withdrawn. If bleeding occurs, apply pressure to the site with the dry sterile gauze until it stops. Bleeding rarely occurs after subcutaneous injection. Dispose of supplies appropriately. Activate the needle safety device or discard the uncapped needle and attach syringe into designated receptacles. Proper disposal protects the nurse, others from injury and contaminations. The CDC recommends not cupping the needle before disposal to reduce the risk of needle stick injuries. Assists the patient into a comfortable position. Flip down medication ticket if not using EMR. Do aftercare, remove gloves, dispose used items in appropriate waste receptacle, return other equipment to its proper place, especially the MAR machine, performs hand hygiene, assesses the effectiveness of the medication at the time it is expected to act, documents all relevant information, the medication given dosage, time, route, and any assessments. Many agencies prefers that medication administration to be recorded on the medication record. The nurse's notes are used when PRN medications are given or when there is a special problem.